All right, we're going to start with hip flexion. So we'll get this video going, and you can see this is an open chain hip flexion in the sagittal plane flexion about the medial lateral axis. And it's just cycling through some of the muscles that we're going to go through in detail that are causing this hip flexion. And note that all the muscles are on the anterior side of the hip joint. So the line of pull is anterior, and that is why they are causing hip flexion. So let's specifically look at the muscles that create hip flexion. Just a reminder, muscles have a proximal attachment, which we call the origin, a distal attachment, which we call the insertion. Muscles don't go from the insertion to the origin. When they contract, they just shorten from both ends. They do produce an internal torque, right? A force times a moment arm, that internal moment arm at any joint they cross. And that's what we call the muscle action. So the action is actually a torque that creates the motion. And muscles are innervated by a specific peripheral nerve. All right, so let's go through the anterior muscles. So they generate an internal flexor torque, and they're the iliopsoas, which now most people separate them into the psoas and the iliacus. We have the rectus femoris and the sartorius. The iliopsoas or the psoas and the iliacus, you can see that the psoas muscle goes up to your lumbar vertebra, so it's coming off the transverse processes of lumbar vertebra 1 to 5, and it goes into the lesser tubercle down here. I'm going to change that color. And then we have the iliacus, which comes off the iliac fossa and goes also to the lesser trochanter. The rectus femoris, we're mentioning it here because it is one of the 4 quadricep muscle groups. So we'll talk about it in the knee with the knee, but it does cross the hip anteriorly. So it creates hip flexion, and it comes from the anterior inferior iliac spine and goes into the tibial tuberosity. We also have the sartorius. It's kind of the yoga or the yoga posture muscle because it allows hip flexion, knee flexion, and lateral rotation. And it is coming off the anterior superior iliac spine and going into the anterior medial condyle of the tibia. This insertion is called pens anserine, and it includes muscles, also the sartorius, the gracilis, and the semitendinosus all insert there. Finally, let's look at an actual hip model. And so this is the anterior part of one os cocci. You can see this is the pubic bone, the obturator foramen. Here's your greater trochanter, your iliac fossa. So what we're looking at is A is the iliacus because it's coming off the iliac fossa and going down here into the lesser trochanter. And then B is the psoas, which is cut off because if we had a spine on this model, it would go up to the transverse processes. All right, finally, when we're looking at the neural innervation for all the hip flexors, so those with a line of pull anterior to the hip joint, they are all the femoral nerve. So we have the psoas major, iliacus, sartorius, rectus femoris, all innervated by the femoral nerve.